Hello.
Hi, how are you?
I'm doing good.
My name is Colette. I'm a student nurse practitioner, and today I will be performing a neurological examination. Can I have your full name?
Soleil Watson,
Can I have your date of birth?
July 28th, 2002.
So you're 18 years old.
Yes, I am.
Okay, very good. Now, Soleil, do you give me consent to perform this neurological examination on you today?
Yes, I do. That's completely fine.
And do you also give me consent to record it and upload it to YouTube for my instructor to view?
That's okay with me.
Okay, good. Now I'm just going to wash my hands. Okay. Now, Soleil, I'm going to give you 3 words, and I want you to remember these 3 words because I'm going to ask you to recall them sometime in our exam. So they are apples, oranges, and bananas. Do you think you can remember those words?
I sure can.
Can you repeat them?
Apples, oranges, and bananas.
Very good. So I'm just going to get started.
Okay.
Okay. Can you give me your full name?
Soleil Watson,
And can you give me your date of birth?
July 28th, 2002.
And can you give me today's date?
It is April 11th,
What year is it?
2021.
Okay. And why are you here?
To get an examination.
And where are you right now?
We're at the clinic.
Okay. And who is our current president?
Joe Biden.
What did you have for breakfast this morning?
A burrito.
Oh, burrito sounds like dinner. Okay, that's good. What was the name of your last pet?
Gucci.
Okay, very good. I am going to give you a scenario, and I want you to think about what you would do.
Okay.
You're walking down the street and you see a wallet on the ground. The wallet has some identification with an address and it has money in it. But there's no one around for you to give to. So what would you do?
First, I would look at the address on the wallet, search up the address, and then return it to the owner.
Very, very nicely. Well done. Now, what were those 3 words I told you?
Apples, oranges, and bananas.
Very good. Okay, so the patient is awake. The patient is alert and oriented times 4. Name, place, date, time, and event. So the patient's speech is clear. Her memory is intact, both recent and remote. And her reasoning skills and communications are well. She's doing well with those. Now, I will move on to the cranial nerve exam. So I will start with the first cranial nerve, which will be the olfactory nerve. Now, this is going to be testing her sense of smell. So I am going to have the patient close her eyes. I'm going to have her cover one of her nostrils, and then I'm going to have her identify the scent. So this will be cranial nerve number 1, olfactory. So, Soleil, can you cover up your nostril really good?
Yes, I can.
You have your right nostril closed and your eyes closed, and I'm going to have you sniff into your left nostril.
Okay.
What do you smell?
Coffee.
Very good. Don't open your eyes.
Okay, miss.
Okay. Then identify the second smell. What do you smell?
Garlic.
Very good. Okay. Now uncover that nostril and then cover your left nostril. Okay. Take a sniff. What do you smell?
Coffee.
Okay, the patient has identified the scent as coffee. Now we're going to do the second scent. Okay, go ahead and sniff up on this one. What do you smell?
Garlic.
Okay, she has identified the second scent as garlic. Very, very good. Now her olfactory cranial nerve number 1 is intact. I'm going to move on with cranial nerve number 2. Probably have you sit over here.
Okay, miss.
This is the optic nerve. So this is cranial nerve number 2, optic. We're going to start off with a vision exam. And to do that, I'll be using my Snellen chart. So usually I'll be 6 feet away from the patient, and she'll be looking at my Snellen chart at a 6 feet distance. But for the purposes of the camera, I'm going to put it close up. I'm going to have the patient cover her right eye, and I'm going to have her read the lowest line.
LTF PH.
Now I'm going to have her cover her left eye and have her read the lowest line.
LTF PH.
Now I'm going to have her uncover both eyes and read the lowest line.
LTF pH.
All right, good. So the patient has identified the Snellen chart. It is 20/20 vision. So that means she can see at 20 feet what a regular person can see at 20 feet. Moving on to optic cranial nerve number 2, we are going to do what's called the visual field by confrontation. So I'm going to take an object and I am going to have the patient cover her eyes. I'm going to be wiggling my fingers, and then she's going to let me see when it's in view. So, okay. All right, can you cover your right eye?
Yes, I can.
Okay, very good. Then let me know what you see.
2 fingers.
Okay,
2 fingers.
okay,
1 finger.
okay, very good. Now cover your left eye.
Okay.
All right, let me know when you can see it.
C2.
Okay,
C2.
all right.
C1.
All right, now uncover both eyes. Okay,
C4.
okay,
C4.
okay.
C2.
Okay, her visual fields of confrontation is intact. I'm going to move on to the fundoscopic exam. For this exam, I'll be using my ophthalmoscope. So I'm going to have that on and ready. And what I'm going to do is be examining the retina. I'm going to take my hand, I'm going to brace for safety. I am going to dim the lights. So I am going to be looking at the patient's right eye with my right eye. Okay, turn that on. Okay. And then, so my right eye coming in. I am visualizing the retina. I am coming in, I see the red reflex. I see the yellow-orange structure. I see the optic disc. The optic disc, the margins are sharp. The cuff ratio is 2/1. I don't see any AB nicking. I don't see any cotton wool spots. Following it in, I visualize the vessels. I don't see any hemorrhaging. Okay, so moving on, I'm going to visualize the patient's right eye with my right eye. Okay, follow it in. All right, hand brace for safety. Okay. Gonna the patient's left eye. Where's your left eye? It's over here. Following in, I see the retina. I see the red reflex. I see the yellow-orange structure. I see the optic disc. The optic disc, the margins are sharp. I see the vessels. There's no hemorrhaging. I don't see any AB nicking. I don't see any cotton wool spots. And the cuff ratio is 2/1. So now, moving on, I will start cranial nerve number 3, which is oculomotor. With cranial nerve oculomotor, they control all the eye movement, extraocular eye movement, along with cranial nerve number 4, which is trochlear, and cranial nerve number 6, which is abducens. So what I'm going to do is have the patients, I will be checking the patient's visual fields in all 6 regions. I'm going to have her not move her head and follow my pen light. Okay. So can you see my pen light?
Yes, I can.
Can you see the tip of my nose?
Yes, I can.
Okay, very good. So I am going to have you now move your head, and I'm going to start off with cranial nerve number 3, oculomotor. Okay. All right. And then I am going to start off with cranial nerve number 4, trochlear, downward medial. Then I will do cranial nerve number 6, abducens. Okay. The patient was able to follow my pen light in all 6 visual fields. So I'm going to come in at about a 10-degree angle. All right, and I see some conversion. Then I'm going to move the object farther away, and I see some dilation. So now that is a conversion. So now I will do a pupillary response. So I am going to be checking for direct and consensual. So I'm going to shine a pen light in your eyes, and I am going to watch for the pupils to constrict and dilate directly and consensually. So light on. I'm going to start off with the patient's left eye. Okay, moving in, constriction. Moving out, dilation. Moving in, constriction. So I'm going to do the opposite eye. I'm going to shine the pen light inwards, constricting, outward. Very good. Inward, constriction, and outward, dilation. So that was consensual and direct pupillary response. I didn't see any nystagmus. If I was to see any nystagmus, then I am going to count the beats. So now moving on, I am going to go to cranial nerve number 5, which is trigeminal. So what I'm going to do is take a sharp and dull object, have the patient identify with her eyes closed if she's feeling something dull or sharp, and where is it located. So have you close your eyes.
Okay.
And I'm going to take an object that is sharp and dull. Okay. And I'm going to start, and I'm going to
Right side dull.
dull forehead, right side.
Left side dull.
Dull forehead, left side.
Right side dull.
Right side maxillary.
Left side dull.
Left side maxillary dull.
Right side dull.
Right side mandibular dull.
Left side dull.
Left side mandibular dull. Okay, so we're going to do again.
Sharp right side.
Right side forehead.
Sharp left side.
Left side temporal forehead.
Right side dull.
Right side maxillary.
Left side sharp.
Left side maxillary.
Right side sharp.
Right side sharp maxillary.
Right side sharp.
Right side sharp mandibular.
Left side sharp.
Left side short mandibular. So the patient was able to identify the sensations of light touch to sharp touch. And now I'm going to have her open her jaw, and don't let me close it. Okay, very, very good. All right. So that was cranial nerve number 5, trigeminal. I am going to move on to cranial nerve number 7, facial. I'm going to have the patient raise up her eyebrows. All right, and I can see the wrinkles in her forehead. I'm going to have her smile. Very good. And then I'm going to have her puff out her cheeks. All right, very good muscle tone. All right, so now that is cranial nerve number 7, facial. We're going to move on to cranial nerve number 8, acoustic or vestibular cochlear, which is cranial nerve number 8. For cranial nerve number 8, I am going to be testing her hearing. And the first thing I'm going to do is whisper a 2-syllable word in her ear without her looking at my face or lips, and see if she can identify those words. I will be checking her neurosensory. Okay, so
Apples.
all right, the patient heard apples on the left and whispered test.
Oranges.
Okay, the patient heard oranges on the right with the whispered test. She was able to identify those 2-syllable words. I'm going to move on with the Weber test, and I'll be using my tuning fork. Going to strike an object and place it on her forehead, and then she's going to tell me where she hears the sound.
I hear the sound even on both sides of my ear.
Okay, very, very good. The patient has identified that she hears the sound on both sides of her ear evenly. So now I'm going to move on to the Rhines test. Striking my tuning fork. Placing on the mastoid. You feel that?
Yes, I can.
Let me know when you can stop hearing it.
It stopped ringing.
Okay, so that was on the left, so we'll do the right. Place it on the mastoid. Feel that?
Yes, I can.
Let me know when you hear it stop ringing.
It stopped ringing.
Okay, very good. The patient air conduction is greater than bone conduction. She was very able to hear bilaterally on both sides. So there was no neurosensory hearing loss. So we're going to move on to cranial nerve number 9 and 10, which is a pharynglossal and the vagus. So what I'm going to do is have some light, and I'm going to have the patient open her mouth, and she's going to say the word ah, and I'll be looking at the uvula.
Ah.
Okay, I see the palate. I see the pharynx is clear. I see the uvula. It is even, and it is not deviated. So now I am going to have the patient do the gag reflex. So I will be taking my tongue depressor, and I'm not going to do it on camera because it's very uncomfortable. So I'm going to verbalize that I am doing the gag reflex with cranial nerve number 10. I will take the tongue depressor against the palate, push it back, and elicit the gag reflex. So instead I have the patient swallow. Okay, very good. Moving on to cranial nerve number 11, which is accessory. So with that one, I'll be checking the trapezium and the sternocleidomastoid nerves, cranial nerves. So I'm going to have her turn her head to the left. I'm identifying the cleidomastoid, subcleidomastoid here. And I'm going to take my hand. Don't let me push it. Okay. All right. Now I am going to turn the head to the right. Identify the sternocleidomastoid, and I am going to take my hand. Don't let me push it. Okay, very good. Very strong muscle tone in there. So now I will do the trapezium, where I have the patient shrug her shoulders all the way up. Don't let me push them down. All right, cranial nerve number 11 is intact, which is a spinal accessory. We'll move on to cranial nerve number 12, which is hypoglossal. So with that, I'm going to have the patient stick her tongue out. Her tongue is even in its midline. Now I'm going to have her put it in her left cheek, and then move over to her right cheek. Very good muscle tone. Very on the left cheek again. Very good muscle tone. Very good. So now I'm going to have the patient stick out her tongue. I'm going to place the tongue depressor on it, and then she's not going to let me push down. Okay. All right. So very good strength of resistance. Cranial nerve number 12, hypoglossal. So we have completed the cranial part of the exam. I'm going to move on to the cerebellum part of the exam. And with the cerebellum, I'm going to have the patient do a normal general gait walk. Okay. Okay, go ahead and walk. Right, and then come on back with a normal gait. Very good. Now I'm going to have her turn around, and we're going to do what's called a tandem walk, where she's going to be placing one foot in front of the other. So go ahead and do the tandem walk. Okay. Balance it out with your arms. Okay, come on back with the tandem walk. Very good. Now I'm going to have her do walk on her heels. Very good. Now I'm going to have her do her tippy toes walking. Okay, very good. Now the patient has did normal balance. There was no accessory use, and she was able to have a normal balance. So now I'm going to have her do what's called the Romberg's test. So I'm going to have her stick her arms out for about 20 seconds. I'm going to have her close her eyes, and then she's going to stay there for 20 seconds so I can check her balance. All right. Very good. Now I'm going to tap my arm against her, so she's not going to let it drop. All right, there's no pronator drift. So the patient has passed the Romberg's test, and I'm going to have her sit down, and I'm going to have her perform the rapid movement test. Maybe on this chair. Adjust the camera So I'm going to have her hands on her lap. And then she's going to perform some rapid movement with her hands. So go ahead. Faster, faster. All right. So the patient's able to perform rapid movement with her hands. She did very well with that. Moving on. Now we're going to move into sensory tests. All right. So with the sensory part of the exam, I will be assessing the sensories. So the first one that I'm going to do is called joint sensation. So I'm going to have the patient spread out her hands bilaterally, and then I am going to pull up or down on her joints with her eyes closed, and she's going to tell me which one I'm doing. So with the one on the right,
up, down, up, down, up.
Okay, moving over to the left.
Up, down, up, up, down.
Okay, very, very good. I'm going to do her feet the same. Put them in the view of the camera. And she's going to let me know with her eyes closed.
Down,
Okay.
down, up, down, up.
All right, that was the one on the left. Now we'll do the one on the right.
Up, up, down, up, down.
Okay, that was the joint sensation test. So moving on, I am going to do what's called the finger, the 2-point discrimination test. So with that, I will be taking the object and I will be poking the patient with her eyes closed, and she'll tell me whether she feels 1 point or 2 points. So I'll be taking a sharp object, like a paper clip, and I will do the upper extremities first. Okay, so close your eyes.
2, 2, 2, 1, 1.
Very, very good. That was the one on the right. Now I'll do the one on the left. Eyes closed.
2, 2, 2, 1, 1.
Okay, very good. Now I'll do her lower extremities. Eyes closed, and I'm going to do the one on the right.
2, 2, 2, 2, 1.
Very, very good. Now I'll do her left extremity.
2, 2, 2, 2, 1.
Okay, very good. The patient was able to do the 2-point discrimination with the paperclip object, and she was able to let me know when I was even poking her once with 1 point, or if I was doing it twice with the other point. Now the other test that I'm going to perform is called the tactile sensation for pain and tactile. So I'll be taking my sharp and dull object again and have the patient close her eyes, and I'll be doing all the extremities, and she'll let me know if she feels something dull or she'll feel something sharp. Okay, so I'll start off on her right arm.
Sharp,
Right.
right side. Sharp, right side. Sharp, right side. Sharp, right side. Dull, right side. Dull, right side. Dull, right side.
Okay, very good. Now I will do her left side.
Sharp, left side. Sharp, left side. Sharp, left side. Dull, left side. Dull, left side. Dull, left side.
Okay, so her sensation on her upper extremities. Now I'll do the lower extremities. So I will start off on her right lower.
Sharp, right side.
Okay.
Sharp, right side. Sharp, right side. Sharp, right side.
Okay, now I will do her left extremity.
Sharp, left side. Sharp, left side. Sharp, left side. Sharp, left side. Dull, left side. Dull, left side. Dull, left side.
Okay. Again on her right.
dull left side, right side, dull right side, dull right side.
Okay, the patient was able to identify the sharp and dull sensation bilaterally on upper and lower extremities. I'm going to do what's called a vibration sensation test. I'll be using my tuning fork. And I will ask the patient to let me know if she feels a vibration. I'll be putting it on one of her joints, bony prominence. What do you feel?
A vibration.
Okay. Still feel it?
Yes, I can.
All right. So the patient's able to identify the vibration with the sensation of the tuning fork. Okay. Moving on, we are going to go into the muscle system, and I will be testing out the strength on her triceps, her biceps, her deltoid, on her upper extremities, her hand strength, and her finger strength. So I'm going to start off with her, maybe sit over here.
Okay.
I'll start off with her deltoid. I have her hold her things here. And I'm going to have her push down. Don't let me push down. Very, very good. I'm going to push up. Don't let me push up. I'm going to put them down to your sides for your biceps. Let's go to the biceps. Don't let me pull it apart. Okay. I'm going to push it in. Very good. And I'm going to take her arms. Don't let me press them in. Then I'm going to press them in. And don't let me pull them apart. Okay. Very good. Upper strength on that one. Now I'm going to have her hands. I am going to start off the one on her left hand. I'm going to have her open her fingers and not let me close them. Okay. Very, very good. Now I'm going to have them close them and not let me open them. Okay, very good. Now I'm going to do the same to the one on the right. Don't let me close them. Okay. And then close them and don't let me open them. Okay, very good strength. And I'm going to have her squeeze my hands really, really tight. Very, very, very good muscle tones. I'm going to have her push against resistance. Very, very good. Now I'm going to do her lower extremities. So I'm going to probably have her on an exam table for this one. So I'm going to have her push up her right leg. Okay, left leg, don't let me push it down. Very good. And then I'm going to push up the right one, don't let me push it down. Okay, very good. I'm going to have her lay down a little bit where I can do her hamstring here. I'll have her, don't let me push down. Okay, to the other side, don't let me push down. Push up against her foot, don't let me push away. Very, very good. I'm going to bend up your knees and don't let me open. Okay, and then I'll open. Don't let me close. Very good. I'm going to take her hip and I'm going to add duct. Don't let me push. Okay, good for the hips. Then I'm going to do the other hip. Push. Then I'm going to have her add duct. So I'm going to, don't let me push you. Okay, don't let me push. Okay, very good muscle tone in all her upper and lower extremities. So I'm going to have her sit back up. All right. So now we're going to do the last part of the exam, which is the reflexes. So I am going to be testing her brachio. I'm going to have her do this one with my hand, which is C6. I'm going to tap down with the hammer. Okay. Then I'm going to do the opposite side. See the brachio, I'm looking at the muscle. Tap, and I got a good response. Also, I'm going to have her bend her arm in. I'm going to tap down. Oops, sorry. Good response. And then, I don't know, the elbow always gets that good response. I'm going to do this again. Okay, good muscle response. Now I'm going to do her patellas. So, move the camera downwards, and I hope it does not fall off this time. All right. So I am going to tap on her patella. Very good. And then her next one. Very good muscle response. Now I'm going to do what's called the superficial sensation. I'm going to take my tip of my hammer and roll it up her foot. Watch her curl, her toes curl. This will be the Babinski reflex. So I'm going to take your foot, put it in view of the camera. I'm going to rub this here. Very, very good. So you see the curling of the toes. I'm going to do the other side. Okay, good response. And this concludes our examination. And thank you for watching. And thank you so much, Soleil, for participating.